All right, I'm going to take you guys through my medications. The reason I'm going to do that is because if this is going to be a recovery and comeback documentary type of album, then you need to understand one, what I'm recovering from, which will entail me getting into a lot more of my medical history, medical experiences, and diagnoses, plural. But I think you also need to understand how I'm recovering. With the help of a lot of specialists, a lot of medical professionals, and also myself. I do a lot of self-care. I do a lot of therapeutic treatments and remedies. I am a strong believer in the combination of natural and man-made. I am a big believer in the balance between Eastern and Western medicine. So I will make a video for all of the other things that I do to treat my symptoms, but this specific video is about Western synthetic medicine. RX pharmaceuticals is why I have my quality of life back, because it was gone. My medications are why I got better, and why I keep getting better. So I'm gonna take you through them. We're at 8. That's almost double digits. That doesn't include anything over the counter, and that's only oral. I have prescriptions that I inhale, sniff, put in my eyes, on my skin topicals. So there's more medications, but we are just going to go through oral prescriptions. That's it. So I blacked out my providers' names to protect their identity. Obviously, any personal information, my address, last name, yada yada, but the name of the medication you'll be able to see. So this is hydroxychloroquine, 200 milligram tab. Now I take, if you see, take 1.5 by mouth once daily. Okay, so because they only come in 200, what I have to do is break these little guys in half. So I take, so every morning, hydroxychloroquine 1.5. Now, this has been a huge help for a plethora of my symptoms, but mainly that is treating my connective tissue disease, that is treating, which is an autoimmune disease, and we'll go more into my actual diagnosis in a different video, but this helps a lot with my very chronic inflammation. Now, the hydroxychloroquine, the main positive factor that has had is it is the only way I have been able to be off of steroids, methylprednisolone. Before hydroxychloroquine, being off of steroids would be intolerable. And I mean, I have wound up in the ER, urgent care. I mean, pretty severe extreme flares and symptoms would happen, some scary situations when I was off of the steroids. However, taking steroids long term, especially in high dosages, is dangerous. It can have dangerous side effects. So I was like, at first, 4 to 6 a day it was the only thing managing my symptoms of 4 milligrams of methylprednisolone. Then we tried 2.5 daily, and that kept me in like a moderate, manageable state. Now, with hydroxychloroquine, I do not take steroids daily, but I am still prescribed them. So this is methylprednisolone, 4 milligram tabs. So it's take 1 tablet by mouth once daily for 2 to 3 days if needed for flare. So now I only have to take steroids if I am flaring, even with the daily dose of hydroxychloroquine. Sometimes I can get away with taking an Aleve or taking some aspirin with my hydroxychloroquine and not taking steroids, but sometimes I do still need them. I have still needed to fully dose pack 6-5-4-3-2-1 while on hydroxychloroquine, and other times just the one is enough. Sometimes it's 2-1, 3-2-1, 4-3-2-1, and I've talked to my rheumatologist about this. It's fine. It's basically call if you need more, but the main goal is to use them as a last resort, which I do. Next. Well, this one's really not a big deal. You can get this over the counter. This is citrazine. 1 tablet by mouth twice daily. So I take this every morning and then every evening as well. Let's talk about allergies. So I go to an allergist, immunology. Actually, immunology and rheumatology are somewhat intertwined. Mind you, anything I say here is just based off my own experience. I am not a medical professional of any kind. I have no qualifications in the medical field at all. So this is just the best of my knowledge from what I've been told by specialists, doctors, my own research, etc. Anyway, so I get a full screening. Go to an allergist, I get a full screening for environmental allergies and chemical allergies. 70 prick test, which is no big deal. It's like little taps. But it all came up negative. I'm not allergic to anything. And the thing is, I could have sworn I was allergic to something because, I mean, I've just always had allergy-like symptoms. So now there are some kind of like specialty allergies that are more rare that you can go to specific places for and get tested for, yada yada. But I got the full screening of the typical common full spectrum of allergies. So, not allergic to anything, still taking allergy medication. What was explained to me is that you don't have to be specifically allergic to something, but you can have like irritants to where you're just highly sensitive to a lot of things and they irritate your histamine system. So, considering I have an overactive immune system, I wouldn't be surprised to find out I have an overactive histamine system. And my fiance also says I have an overactive mind. So, anyway, I take these allergy pills, even though I'm not specifically allergic to something, just to control the histamine reactions to like irritants. And honestly, it's been helping. I used to take allergy pills only when I was having symptoms. Now I take the twice a day and regularly, and I don't wake up all congested anymore. I don't have as many symptoms anymore. I go for walks and don't need as many tissues. So it's kind of like, instead of taking it when the symptoms are there, taking it regularly is preventing the symptoms from being there at all, which is preferable, obviously. Let's go to the next allergy one. So this is famotidine, 20 milligrams. This is also twice a day, in the morning and at night. The fun thing about this is it is an antihistamine, and it treats a different kind of histamine than the cetirizine. So there's two kinds of histamine. So I'm kind of covered for both of them, but also I have a lot of GI symptoms, a lot of acid reflux, a lot of GI, like bloating and nausea and all kinds of stuff. But anyway, for the acid specifically, famotidine Pepcid is also an acid reducer. It doesn't prohibit you from producing acid, but it will neutralize it. It will lower it when, if you produce too much. So those two allergy pills, plus the help with the GI acid factor, 2 birds, 1 stone with the Pepcid, those twice a day, every day, been really helping. And then another great thing about that is I'm trying to control my immune system. So ideally, I don't want to need more meds and more meds and more meds. So controlling it in more natural ways is good. So I wear sunscreen. I protect myself from the sun a lot, from different triggers. But if I'm always having upper respiratory system symptoms, then just that little bit of irritation in your body, just that little bit of stress on your body can trigger your immune system into a flare. So it's better to really alleviate every symptom so that your body is just calm. You don't want the slightest stressor on your body. All right, so although the Pepcid definitely helps my GI symptoms not be as frequent, if I do get nauseous, the only thing that will stop me from vomiting is Zofran. Now this says on Dancetron, 4 milligrams. So take 1 by mouth as needed for nausea. Take 1 tablet by mouth every 6 hours as needed for nausea and vomiting. So I remember times where I was in the hospital just vomiting and it wouldn't stop, and they actually gave me an injection of Zofran. Instant stop, just full stop. And now if I feel a little like hard in my stomach or just weird, I feel a wave of nausea, if I can get this in my system before it starts, it'll stop it. Sometimes if I'm too late, it'll come right back up. So, but usually if I do get nauseous, even on the Pepcid, and like Pepto doesn't work, I'll take that sometimes. I will take a Zofran and it'll settle my stomach right away. Well, within like 20 minutes. All right. Next, this is as needed. This is cyclobenzaprine, 5 milligrams. Muscle spasms. Okay. Cyclobenzaprine is Flexeril, which is a muscle relaxer. This helps actually a lot with my back pain. But it can also help sometimes if I'm very twitchy at night or like my muscles are jerking and it's keeping me up. A muscle relaxer will help me like relax and go to sleep. And then this is gabapentin, 100 milligrams. Take 1 capsule by mouth 3 times daily as needed. So sometimes I take 1, sometimes 2, sometimes I do take all 3 throughout the day. I've taken all 3 at one time, depending on the severity of the situation. So this is for nerve pain, neuropathy. I get it kind of everywhere. So this really just slows down the nervous system and helps with nerve pain. Now, a golden combination is gabapentin and muscle relaxers together. I was, years ago, prescribed gabapentin and Flexeril to take together, and for my back, it was so good. That was back when I was in physical therapy, and I think even seeing a chiropractor. But now they're separate scripts used as needed, but sometimes I do combine them. If I'm having nerve and muscle problems, I'll take one of each and it'll really just fix me right up. Now, the last medication I want to talk about, and I really want people to hear me on this one. This is sertraline. This is 50 milligrams. This is once daily, only at night. That is Zoloft. Okay, let's talk about this. Now, I am prescribed that for generalized anxiety. First of all, if you have a chronic inflammatory disease in your body, just that level of stress on your body can cause anxiety in itself. Then there's life. Okay, so I don't know if it's primarily a symptom related to my rheumatoid disease. It could be. It's common, but it could be other factors as well. Either way, generalized anxiety. So let's talk about Zoloft. Zoloft can treat anxiety and depression, which, if you're very ill, sometimes you get a little sad. Anyway, I want to talk about what it actually does. According to my research, again, I am no professional. This is just based off my own research and information. It's a serotonin reuptaker, and my understanding of that is it's not a lack of your body producing serotonin. You make serotonin, but then your own body reabsorbs it. So this is God, I forgot. I completely just lost my train of thought. Serotonin. So this is it serotonin? Yeah, you make serotonin. So this being a serotonin reuptake inhibitor means it basically inhibits the reuptake, the reabsorption of your own serotonin. So you produce it, but then I think like my body is basically eating it. So it's reabsorbing what I need to feel happy. So I don't know why, but that's my general understanding of what this medication does. It inhibits, which means stops, prevents the reabsorption, reuptake of your serotonin. Now, this is technically not a physical health drug. It's like a mental health drug. Now, my general opinion on that is I don't understand why the separation of physical and mental health. Why the separation of physical disease and mental health, mental disease, mental health issues, mental health symptoms, and physical health symptoms? So this is my logic on it. Your mental health, our mental health, is our brain. Your brain is a part of your body. It actually, your body can't function without it. Your brain has to send signals to your body to tell it what to do. So your brain literally runs your body. It's an organ. So I don't understand why we separate that organ as a separate health department, but all the other organs are considered like physical health, where that is considered mental health. Your brain, our brains, are an organ in our body. They are a part of our body, our physical body, which means taking care of your brain is taking care of your physical health. Mental health is physical health. It's the same thing, okay? And the separation of it, I think, is why historically it caused a lot of stigma. It's one of the most essential and important organs in the body. One of the ones we can't actually live without. Might be able to have a heartbeat and breathe without on a machine, but can't actually live independently without our brains. Anyway, that's my general opinion on the mental health side of things. Take care of your mental health just like it's your physical health, because it is. It's your brain. It's just as important as your heart, your lungs, your kidneys. It's the same thing. So don't separate them. Anyway, so back to my daily medications. I'll go through them real quick again. Hydroxychloroquine, 300 milligrams. Citrazine, 10 milligrams. Famotidine, 20 milligrams. This is every single morning. Then we have methylprednisolone, steroids. Great for getting rid of inflammation. They will wipe it out of you. I am lucky enough to not have had any adverse reactions or side effects to any of these meds. I've only really reaped the benefits of them treating my symptoms. So I know different systems react differently to medications. I have just been lucky enough to find a combination that has skyrocketed my health back up compared to what it was not so long ago in reality. So I fully credit these meds to a speedy recovery, giving me my quality of life back. I was in a lot of pain. But, so these guys are only as needed. When I'm in a flare, we take those with the hydroxychloroquine, only in a flare. The hydroxychloroquine is daily to prevent flares, which it does a pretty good job. Gabapentin, citrazine, and gabapentin, Flexerol, cyclobenzaprine, and Zofran. These are all as needed. So if I'm having nerve pain, if I'm having muscle myalgia type stuff, if I'm having nausea, these are all basically to treat symptoms that come with a flare. And then Zoloft, 50 milligrams, one every night. So some daily in the morning, some daily at night, some only as needed, but that is all of my prescribed oral medications. We'll go through all my other scripts that aren't ingested in another video. So the objective of this video is really, this is how I'm seeing a recovery. So as you see me doing more and more, getting stronger, you know, getting back in a gym. I can't believe I went back to a gymnastics gym. There was a time I was struggling to walk, so huge difference. So, you know, I've done the Manitou Springs Incline and swam again, and everything you're seeing in this album, that's really just me bouncing back, and I don't seem like a sick person. These are why. All of these meds. Because if you are a sick person, you should take your medication that makes you feel better. That is my general opinion. I know some people have a rough road with finding the right combination, and they don't have maybe they don't have really great effects on their meds. So I've heard situations where the side effects are worse than the symptoms, so they just choose to not take it, and that's sad to me. I haven't experienced that. So a lot of people really struggle to find a medication that works for them and helps them. Sometimes you can have adverse reactions. There are people with multiple conditions where the medication that they need to treat one condition is not good for another condition, for their other condition. So it's about finding a medication that really works with both. I've been, honestly, with the stories I've heard, horror stories, I've been really lucky with medication. I respond very well to it. I've had a bad reaction to one allergy med that I was on and stopped taking it, and I had one migraine medication that just didn't work. It didn't do anything. It didn't make me feel bad. It just didn't work. So no point in taking it. I'm definitely on the put as little in your body as possible of this kind of stuff. But if you need it, take it. Anyway, so as I continue in this album, this video is the how I'm recovering just on the synthetic medicine side. And there's a lot of other stuff I do. Like I said before, I have a whole regimen of treatments. And it all helps, but without these medications, my symptoms get very severe. And pretty extreme things happen to me. So I'm not going to stop taking them unless they find a cure.